as the federal government ramps up production and distribution of coronavirus tests nationwide. Testing supplies in southwest Colorado remain in short supply. You're watching the Local News Network. I'm Wendy Graham-Settle. In a news release on Monday, March 16th, San Juan Basin Public Health announced that COVID-19 tests generally would be restricted to critically ill, hospitalized patients. Residents who have symptoms of fever, cough, and shortness of breath should assume that they have COVID-19 and distance themselves from others. If you have symptoms, do not show up at your doctor's office, urgent care center, or emergency room. Call your doctor first for a treatment plan. Dr. Jennifer Rupp, infectious disease physician with Mercy's Four Corners Infectious Disease and Internal Medicine Clinic, said that Mercy Regional Medical Center is limiting COVID-19 tests only for those patients who qualify for admission. Test results take 3 to 4 days to process. Patients should not be reluctant to go to the emergency room if instructed by their physicians. Testing currently is covered by a grant from the Colorado Department of Health and Environment, and uninsured patients will not be billed. When Governor Polis declared a state of emergency, insurance companies were instructed to waive patient copays and deductibles for COVID-19 testing and treatment. Rupp said that Mercy had deployed its COVID command team that meets daily to respond to changing guidelines for evaluating patients and for coordinating efforts with state and local health departments, emergency responders, Flight for Life, and primary care offices in Durango. Mercy has 10 intensive care unit beds, but can expand beds as needed in other rooms. It has a total of 20 ventilators available to treat respiratory complications. In addition, it is working closely with all hospitals in the Centris system for additional support. While no vaccines have been developed to prevent the novel coronavirus, or COVID-19, San Juan Basin Public Health encourages you to practice good hygiene. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water aren't readily available, use a hand sanitizer with at least 60% alcohol. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home if you're sick and keep your children home if they're sick. Cover your cough or sneeze with a tissue and throw the tissue away. Clean and disinfect frequently touched surfaces and objects using a regular household cleaning spray or wipe. Symptoms of COVID-19 include fever, cough, and shortness of breath. Illness can be severe and require hospitalization, but most individuals recover by resting, drinking plenty of fluids, and taking pain and fever-reducing medications. People at risk for complications include the very young, the elderly, or those with underlying medical conditions. If you believe you've been exposed to the COVID-19 virus, call your doctor to assess whether you should be tested and for further instruction. Do not show up at the emergency room, an urgent care center, or your doctor's office to avoid the spread of the virus to others. If you do not have a doctor, call San Juan Basin Public Health at 970-247-5702. If you'd like to know more or to find answers to frequently asked questions, visit San Juan Basin Public Health's website at sjbpublichealth.org/coronavirus.